Day for the Storytelling for Systems Change webinar. We will be recording today, so please just accept that on your screens if that's something that you are comfortable with. We just want to make sure to make this a resource available to others who are not able to make it today. We are so pleased to have you all, and if you haven't already, please introduce yourselves in the chat. We invite you to share your name, your city and county, what role you play, or what brings you here today. My name is Somo Suparakchinda, and it's my honor to be here as a strategy advisor to the California Perinatal Wellness Alliance, or what we affectionately call CPWA. I'm here today with the founding director of CPWA, Cassie Manjikian, as well as Jess Ford, our storytelling and policy intern. And Monea Jennings is also joining us as a California State Senate Fellow for Senator Smallwood Cuevas, who is a co-author of SB 626, which you'll hear more about today if you're not already familiar with it. And for those who are new to CPWA, we are a survivor and community-led statewide coalition focused on perinatal mental health. Our work cuts across three pillars: policy and systems change, convenings and movement building, and storytelling and narrative shift. As examples of those, in our policy work in the last year to two, we've been working on SB 626, a state bill to improve perinatal mental health. In April, we hosted a roundtable where we brought together a range of state agencies in partnership with the Office of the First Partner and the Office of the Surgeon General, and we're excited to be continuing the work of that through today. As far as convenings, most recently in May, many of you may have been at the Pain to Power community convening in LA, where we had more than 150 survivors of perinatal mental health join in a day of healing and systems change. And then in our storytelling work, we continue to collect and share stories through a storybook, and we will be doing that this year in its most recent iteration through September 1st, so that those with lived experience continue to drive our movement. And then today is really about working across those three pillars, across policy, convening and movement building, and storytelling, because we know that those are most effective when we are working on them in concert. Um, we also heard at our Pain to Power convening in LA a desire for ongoing community building. And we hear you and we are with you. It's very much aligned with CEPA's interest in building the statewide movement for perinatal health, making sure we bring together patients, providers, advocates, funders, decision makers, and that we create ways to support one another and to together reimagine what a just, equitable system for perinatal health could look like. And in addition to this event today, part of our hope is that we will plan quarterly virtual convenings to create those additional opportunities for survivors and for this community to come together. Our next one is scheduled for October 8th, and we hope that you will join us for that, and we'll share more information shortly following this meeting. And then before we dive in, also want to acknowledge our funders. We are so grateful to First 5 LA, the Perigee Fund, the Flora Family Foundation, and the Flourish Family Foundation for their generous support. They are among our first institutional funders, and they've been major champions for events like this, where we bring lived experience in with storytelling and advocacy. As far as today, we will be focused on storytelling. This is a statewide advocacy training. And what we hope to do is to help you understand this moment, why now is particularly important for the work that we will do together over the next hour. We want to share with you a story framework. There are many different ways to tell stories and also some specific guidelines for how it can be used for advocacy and policy change. We will certainly share some examples so that you see storytelling in action. And then we hope that you walk away clear on at least one next step for how you could contribute to our movement for stronger perinatal mental health. We want to be clear that today we are not providing therapy or peer support. Of course, these are important, but our focus for this session is really equipping you to turn your experience into tools you can use for advocacy. So, some reminders so that this is a safe place, safe space for all of us. One, first and foremost, take care of yourself. It's up to you to define what that means. You may need to step away if something becomes triggering or overwhelming during the course of our time together. Please share only what you feel comfortable with and own your story. It really is your story to share in the ways that you are comfortable, and we will do what we can to support that, provide some resources at the end to make sure that you feel supported. And our focus here today is equipping you with those tools. And so, with that, I will hand it over to Cassie, who will dive into why this moment matters and how we can keep building the momentum towards stronger perinatal mental support for all.
Thank you so much, Somo, and thank you everyone for taking the time to be here today. Whether you're joining as a parent, a provider, advocate, family member, or community leader, we're so glad you're here. It's amazing to see all your intros and backgrounds and experiences in the chat. Today's training isn't just about telling our stories, it's about understanding how our stories can help improve the systems that families depend on. And like Somo beautifully said, our hope is that you'll leave today with a simple framework for sharing your story in a way that supports both your own healing and meaningful systems change. So, why are we here today? So, nearly 2 years ago, when CPWA was founded, we hosted our first From Pain to Power convening on storytelling and policy change. And although every story was different, just like we've seen in the chat, different experiences, one message kept coming up. Folks kept saying, I was screened, I was handed a piece of paper, and that was it. I was mostly on my own after that. And families knew something was wrong, and providers often did too. But too many people still fell through the cracks. And these conversations are what helped inspire the work we're doing today. Over the past few years, California has made real progress expanding screening for perinatal mental health conditions like postpartum depression, anxiety, and psychosis. And that's something our advocacy community here should be really proud of. But screening is only the beginning. And families need support throughout the entire care pathway, from screening to clinical evaluation, diagnosis, referral, and treatment, and ultimately recovery. And I'd love to hear from you all in the chat. Where in this pathway do you think that families most often fall through the cracks? And I'll pause for a minute. So, as people respond, I invite folks to notice the similarities and differences across California after screening, screening and recovery, referral, a few more screenings. Yeah, so again, it's that piece of paper, right? And not having the clinical evaluation, not knowing what to expect going into pregnancy and childbirth, support after screening, referral, absolutely, after each point, right? And so there's no matter where folks enter the system, we know that a positive screen should lead to meaningful connection and care and not the end of the conversation. So that's exactly what SB 626 is designed to strengthen. It doesn't create a brand new system, it strengthens the one we already have by improving follow up after a positive screen, case management, and care coordination to guide folks along that care pathway, and then quality improvement and accountability. And ultimately, it's about helping more families move from screening to recovery. And over the past few years, we've worked closely with healthcare partners and state agencies and legislators to refine this bill. And now we're entering one of the final stages of the legislative process. And that brings us to why we're here today. Legislators hear data and statistics every day, and those are important, but stories help them understand why the data matters. Your lived experience can help build understanding, strengthen support for SB 626, and ultimately improve care for the next family. And today we're going to talk about how to do that effectively. So, before we talk about how to tell our stories, I want to pause for a moment and think about why stories matter in the first place. And we do have really strong data. We know that more than 1 in 3 California birthing people reported symptoms of depression or anxiety in 2024. And we also know that 85%, which is far too many families, still don't receive timely, effective care. But data can only tell us so much. It tells us how many people are affected, but it doesn't tell us about that pathway, right? And what it felt like to be sent home with support, without support. It doesn't tell us what it was like to call 10 therapists and never get a call back. It doesn't tell us what it was like to be afraid to even ask for help in the first place because you're worried someone might judge you or worse, take your baby away. And that's what stories do. And again, I'd love to hear from you in the chat. What's one barrier you've seen or experienced that makes it harder for families to get connected to care? And I'll pause for another moment. We talked a little bit about uh, stigma, perinatal, here we go, perinatal specialists not accepting insurance, stigma, denial, afraid of the implications, accessibility, finances, absolutely, language barriers, stigma, shame, busy, overwhelm after the birth to realize they were traumatized by it, absolutely. People just don't know where to go for support, what's available. They don't even know where to start. Yes, and that's sort of, I talk about perinatal mental health. It's sort of you don't know what you don't know, right? Not knowing who to call, not recognizing symptoms as postpartum depression, lack of knowledge by providers, nuanced experiences, presentation of symptoms not fitting set diagnosis criteria, absolutely. Lack of specialized providers, lack of awareness, need of childcare for other children. Wow, yes, this is a really rich data bank. And what's really powerful is that every one of those barriers points us towards an opportunity for systems change. So, again, data tells us what's happening, and stories help us understand why it matters. And when we bring those two together, we build the public understanding and ultimately the public will to create change. And that's exactly what we've been trying to do here at CPWA. So people sometimes ask us, how do stories actually change policy? And here's how we think about it. Stories create empathy, moving people. I've already been moved even from the comments coming here in the chat. Empathy builds relationships, relationships build community, and communities build public will. And public will ultimately helps change policy and improve systems. And that's the pathway we've been building together over the past 2 years at CPWA. We've seen it from happen through our From Pain to Power convenings, our Advocacy Day, our state agency roundtable, and our ongoing work to advance SB 626. Um, so most of us probably didn't wake up one morning thinking, I want to become an advocate. Usually it starts much smaller. We might want to make sense of what happened and put that personal story or narrative even together conceptually. Maybe we tell our story to a partner, a therapist, or a trusted friend. And as we do that, the story takes shape. And we also realize that we're not alone. So that's the healing process where that becomes connection, connection becomes leadership, leadership becomes collective action, and over time, collective action changes systems, creating healthier families and communities. So I'd love to hear from you again in the chat. Looking at this pathway, where do you see yourself today? And again, there's no expectation that everyone ends this webinar in the same place. Some people may be here to heal and process and put that personal story and narrative together. Some are here to learn. Some are ready to advocate. And some are already leading and have been doing this work for many years. And every person, every place on the journey matters. And I absolutely love seeing connection, collective action and systems change, leadership from connection to leadership. Awesome. This is beautiful. Thank you. So we've watched this journey unfold again and again. And, even at our Pain to Power convenings or advocacy day at the Capitol, we saw how 40 advocates, including 25 survivors, told their stories in support of SB 626. And that ultimately persuaded Senator Valladares on the Senate Health Committee to share her story of perinatal mental health challenges. And the senator next to her said, "Hey, me too." The senator next to her said, "Me too." At our state agency roundtable, we delivered our Breaking the Silence storybook to first partner Jennifer Siebel Newsom and Surgeon General Dr. Diana Ramos. And through that process, we saw that Jennifer Siebel Newsom actually shared her postpartum story for the first time of how, after her 4 children, she went through some perinatal mental health challenges. And in that story, she said the governor of California looked at her and said, "Hey, I didn't realize you went through that," right? So, this is where our countless conversations with legislators, healthcare leaders, decision makers, and even this training here today does really make a difference. And remember, every advocacy journey looks different. Some people begin by sharing privately with a loved one, therapist, doula, or provider. Some might write their story in a journal, a poem, a drawing, or in our statewide storybook. And others may choose to share more publicly through legislative meetings, writing support letters, provider education, sharing your story in a documentary, a podcast, or on social or earned media. So every role really does matter. And the most important thing to remember is that your story belongs to you. So you decide every time whether to share, what to share, when to share, and who to share with. And one story can create many different opportunities for change. So, with that, I'd love to introduce someone who has been helping build this work behind the scenes for over the past year. Our incredible storytelling and policy intern, Jess Ford, is going to share her story along this pathway from pain to power and storytelling to systems change, and a simple framework for turning lived experience into an effective advocacy story. Jess, I'm so excited to hand it over to you.
Thank you so much, Cassie. It's wonderful to be in this space with everyone. So, as said, I'm the storytelling and policy intern for CPWA. And I wanted to start by just sharing a little bit of my own advocacy journey. So, as you'll see, the photo on the left, that is me 4 days postpartum with my baby. I did experience perinatal depression during pregnancy, but I wasn't being treated. And in this photo, I was really struggling with feeding. You'll see the pumps, the syringes, the thermometer, and all of this developed into postpartum depression, postpartum anxiety, and OCD. I was a doula at the time, and I felt extreme shame around knowing all of the ways I could and I should help myself, but I just couldn't do it. I was never screened, I was not seeing a provider, and I struggled for 9 months until I finally received professional help. The middle photo, you'll notice, you'll see I took that from the audience from the first Pain to Power in 2024 convening. My child was 2 at the time, and I remember it took a lot of convincing myself to go, and that I should attend both for my personal healing journey and then professionally, I wanted to become a part of advocacy work. At the time, I wasn't going on many solo outings. Again, I had extreme postpartum anxiety, but I knew I should go, and it changed my life. And my healing felt really slow, but I kept I had constant engagement and keeping up with newsletters, keeping up with the events and what was going on in the community. I might not have been attending, but I was staying mentally and emotionally engaged in advocacy, and I had the awareness. And so a year later, after that, attending that convening, I saw in the newsletter that they were hiring for an intern. So I applied, and that's where I began my advocacy work. And so you'll see me here at the second Pain to Power we just had in May with the team, and all of this to show kind of my journey from healing towards advocacy and kind of that slow engagement through it all. And so moving to the next slide. So over the past almost a year now of serving as the intern, I've had the honor of growing the storytelling pillar of CPWA and continuing to expand our storybook by hearing and holding diverse stories. So we started with a bunch of very powerful survivor stories. And the work that I did was really wanting to expand that to not only just survivor voices, but partner and family voices. 1 in 10 fathers and partners experience perinatal mood and anxiety disorders. And I also wanted to expand it to provider voices because so many people interact with and are affected by PMADs. We really feel like it was very important to display the broad range of voices to amplify how significant this work is. And many providers often receive these clients, when it's far not too late, but way further in the process. And so hearing their experience working with people has been really powerful to capture their voices as well. And so we wanted to offer up a 5-part advocacy framework. Many times people are drawn to this work, they want to contribute, but they don't quite know where to start. And so we wanted to, you don't have to follow this to a T, but really wanted to offer up a framework that you could follow to start organizing your story, right? So for our framework, for the first part of it, go ahead, Cassie. What happened, right? Just starting with what happened, right? You can ask yourself questions like, what were your expectations entering into your perinatal journey? What were the symptoms that you experienced, right? You could describe their onset, the duration, the severity, and any factors that may have contributed to that. And then the next part of the framework, how did it affect you or your family? This could look like, thinking about describing a moment where you felt unseen or unsupported, and what were you feeling during that moment? And then the next part of the framework we have is, where did the system break down? So we're shifting from your experience to where was that gap? Where did that happen? So were there any barriers or systems gaps that contributed to your experience? A lot of people mentioned stigma or, fear of disclosing what they were going through. Yeah, and you could also ask yourself, what did you need that you didn't receive? And if you did receive help, what was beneficial at that time? Did it work? Did it not? Kind of showcasing, again, that gap and where it broke down. And then the next part of the framework, what needs to change? So here we're kind of shifting from your story, your experience, to what really needs to change, right? So what would it have meant to you if someone had caught this early, if you had been screened? And then finally, the last part of the framework, what is your clear ask? So this is becoming, quite directive in your storytelling, like what needs to change, and what do you hope for change? And so moving on, we wanted to showcase an example of a story that we were fortunate to film, showcasing Lagaya's journey from healing to advocacy. And I encourage everyone during this time, just kind of take, mental note of how she might uphold this framework we just presented, how her story is unique, and what you find most impactful in her story as we view it.
My name is Lagaya Lang, and I have one beautiful daughter named Maddie. I was an only child, and I had a lot of pressure on me to achieve. My dad's a chemical engineer, my mom's a nurse from the Philippines, so I'm half Filipino, and Lagaya means happiness in Tagalog. And the night we announced that I was pregnant, it was the day that they closed everything due to the pandemic. I felt good. I had a really easy pregnancy, but I kept worrying about, would I get postpartum? Am I going to get postpartum? Having a mother who's Filipino and extremely nurturing and loving, but the way it influenced my view of motherhood was that the mother is everything to the child and that it should come very naturally. I actually took that as pressure. Given I'd been a career-oriented person for so long and I married later and we planned her, and I was pregnant within like 2 months, and that's when I started to worry about what's gonna happen when there's just me, my husband, and this baby. Am I gonna take to it the way my mother did? And I remember being wheeled into the C-section and crying when she came out and saying, "I love you, baby, I love you," but feeling kind of obligated to say that. And I immediately asked myself, do you feel that feeling? I was put so much pressure on myself immediately. And I wasn't telling anyone, it was all in my head. It got worse and worse. I loved her, she needed me, I could take care of her, but being worried that I was gonna jump over the balcony and run away from my family. I felt like a complete failure for someone who also had defined herself by her career, to not be working and to not even be a good mom. Couldn't be a mom, couldn't work, couldn't get better. I didn't know what to do. So when I finally went to the IOP, I actually felt supported. It was incredibly helpful because it was 6 or 7 women. We would have our babies during the sessions. And so then I was referred to CPWA House, a residential treatment center in Ohio that specialized in OCD. Nobody specializes in postpartum anything. And one day I would like to start my own nonprofit advocating for residential care facilities and resources, treatment centers that allow you to bring your baby and specialize just in perinatal illness. Women need to know about this. They need to be better prepared, and they need to know where to go when it happens.
Okay, so we wanted to open it up to the whole group, right? Feel free to bring yourself off of mute for any reflections on what did you hear, the human impact, where did you hear the systems gap, the proposed change, or the call to action. Curious what stood out to people the most here in Lagaya's story. For me, the most impactful part was hearing the worry starting when she was in pregnancy. And I think slowly that anxiety builds, and without it being treated early on, it really snowballs and I think amplifies postpartum. Yeah, the pressures we place on ourselves is enormous. Yeah, and hearing Lagaya's, cultural implications of what she expected motherhood to look like and not living up to that.
I heard a few things, and one of them were just how her baby was born, and she's like, I love you, baby," but feeling obligated to say that because that's what you're supposed to say when you have a baby. And then another one is wanting to jump off the balcony and run away. Like, oh my goodness, I felt that to the core. And and honestly, with postpartum depression, I just wanted to jump off a balcony and not exist anymore. And so that part of the story really touched me. And then the call to action and proposed change is like there's no inpatient facility that can help with these perinatal illnesses where you can bring your baby. And in my mind I'm thinking, well, what would that look like? Because will I have scheduled visits with my baby? So it's
Mhm.
just a lot of research that's missing on that as well.
Yeah, thank you so much for speaking up and sharing that. I think that, having the intrusive thoughts become so overwhelming and then you don't want to share them, then thinking about the logistics of getting care. Okay, I might be feeling this way, but what am I going to do with my baby, right? Like I have to, who's going to take care of them? And having care be so inaccessible to kind of just amplify everything. Yeah, I'm seeing in the chat the worry that accumulates and that we carry without voicing because we're so afraid of the symptoms, right? That fear, that stigma. For me, it was that her identity attached to her career, right? And just kind of the expectations of mother, career. How do I do it all? I can't do any of it. When we have anxiety to begin with, and then we don't have the right kind of people around us. Yeah, yeah, exactly. Support systems and the lack there. Yeah, thank you all so much for your contributions and your input there. It's really helpful to kind of see how these stories can be shaped through these experiences. And so now I want to pass it along to Monea. She's going to continue to go over effective advocacy stories. So to Monea.
Thank you, Jess, for that. And I really want to dive deeper into just what makes an effective advocacy story. Your story doesn't have to be dramatic or really powerful. It just has to be real. The strongest advocacy stories are specific, authentic, and focused. Instead of sharing your entire life story, focus on one experience that really illustrates the problem. You can connect your experience to a larger issue and help people understand that your story isn't just about you. It's about the policy and how many people are affected just like yourself. And always end with an action. A good advocacy story answers the question, what do you want your audience to do about it? And during your advocacy, you're never obligated to share your deepest trauma to be an effective advocate. You want to share what feels safe and what feels purposeful to you and what's comfortable. You can tell the truth without telling every single detail of your life. And remember that you own your own story. You get to decide when and where and with whom you share it with, as was stated earlier today. And now we can move to the next slide for some do's and don'ts. Some do's is really just use plain language, everyday language instead of policy jargon. For people like me, we look at policy language every single day. What we don't hear is your story. And you, again, you want to end with a clear ask, whether that's supporting a bill, funding a program, or just changing a policy. You want to prepare a 30-second elevator pitch, whether that is just something quick that grabs our attention. You want to have a 2-minute elevator pitch for longer meetings. Still, something quick, straight to the point, grabs our attention. And some don'ts is don't cover every challenge you've ever experienced in your life. You don't want to overload your audience with statistics. Again, we read the statistics every single day. Your personal experience is what we will remember the most. And just some prompts for when you're about to start your advocacy work and just don't know where to begin with your story. You could start with just what experience first made you realize something in the system wasn't working? Or how did that experience affect you, your family, or your community? And if you could change one thing so someone else doesn't have to go through what you did, what would it be? And I will end with just facts and data tell us what's happening, but stories help people understand why it matters. So your story matters, even if it's the same as others. Every story is unique and we want to hear it. Now we can open it up for a brief Q&A.
Yeah, so feel free to again jump off mute, ask any questions that you have for any of our facilitators, Cassie, myself, Monea, or Somo. We're here to answer them. We want to know what feels clear, what feels hard, and where might you use your story. Yeah, and any specific questions that have come up throughout this. Yes, go ahead, Jana. Oh, we can't quite hear you if you want to pop off mute.
I said I'm having trouble seeing everybody. Just I see like five people. So my problem or my struggle as a teacher, um, seeing the changes that I've seen. It's been 32 years and things have drastically changed in the last, or as everybody maybe knows, in the last 6 years because of the Arrive trial and the induction epidemic. So I'm seeing lots more really traumatic births for women. And I don't follow my women that much afterwards. I mean, we have a reunion, so I really can't tell you how many of my women are having postpartum depression and mental health disorders, but I know how many of my women are having upsetting births. And my the reason that I could no longer be quiet after all these years of teaching a really thorough and a really objective course that talks about postpartum as a whole class and a half, on the relationship changes and on the mood disorder spectrum and on the dads and on the mom's feelings that are going to happen and on the predisposing factors or higher risks for postpartum depression. I'm just so angry now. That's my problem, is that I'm angry. And I wrote this book and there's a lot of anger in it. And it's gone through several permutations and now it's being recommended to me that I make it really, really short and do like a piece that hopefully could be published somewhere. And I kind of said to my editor, if maybe this got like this is like 86,000 words down to 2,000 words. So I said, well, maybe if I could do this in three parts, maybe I'd be fine. It doesn't have to be a book. I just want my voice to be heard because I'm so angry at what's happening and I feel so impotent that even when I teach, everything has changed. Everything has just completely changed. Um, and I got a lot out of you saying that an advocacy piece should end with a call to action or what people can do, because that is kind of missing from my stuff, because I just feel so impotent. It's like I tell you this and I tell you this and your doctor tells you that, and they have to make their own choices, but their pressure is unbelievable and the birth outcomes are like night and day. I mean, I do my own research, from how they looked up until 5 or 6 years ago. I guess that's what I want to say. Because
Yeah,
I'm sure that those are affecting women afterwards, even though, they're still yeah.
yeah, and I think, what resonated with me the most is like this really profound anger. And I think part of along the healing journey, I think we think of a lot of hurt, a lot of sadness, like depression, things like that. But the anger and the rage is there too, whether it's something that we've gone through as a survivor that we're seeing as a provider, where it's like, I'm angry that these things are happening, but what do I do with that anger, right? And I think you bring up a great point. How do we maybe turn anger into advocacy and having that be a part of like the storytelling mission? All stories are different and there's different perspectives and like I've heard plenty of stories where it's a lot of rage, and it's like, how do we turn rage into advocacy and kind of landing on like, I have all of this and I'm holding it, and then what's the call to action, right? And so, really kind of nailing down this is what needs to change, like in a very direct, concise way. But I appreciate you sharing that because, you're speaking on 30 plus years of, witnessing and holding all of this, and it's like, what do we do with it? Yeah. I'm seeing in the chat, are there safe spaces that we can share our stories or practice sharing our stories? That's a great question, Carmen. So part of my work with CPWA is offering that safe space. So we have a few different ways you can share a story with us. Specifically, I am a trained doula. I'm trained in perinatal mental health, so I offer a consultation just to kind of meet and share your story verbally. So you don't have to sit down and write it alone. It's confidential, it's safe, processing with me. And in that way, you can either just process it and be like, okay, I'm not ready to share it yet, but I'm getting the hang of telling it and, processing in that way. And also just, we can transcribe that, we can do something with it or not, right? This is your story to own and share. So we wanted to offer up a safe space within CPWA to start practicing and sharing your story. But a lot of storytelling, what I've learned in my internship is the writing process, like just writing it down, or even just talking into your voice memo of like, this is what I went through, just to start verbalizing it and saying it and kind of releasing it that way. I don't know if anyone else has tips of, along the lines of practicing your story.
Yeah, this is a great dialogue. Thank you, Jess, and thank you everyone for the great questions. I'll just say, there's a lot of resources to practice sharing as part of the healing. Maternal Mental Health Now here in LA County has their Sana Sana program that's a peer support. Postpartum Support International also has a number of different peer support programs around different conditions along the perinatal mental health spectrum from, an OCD group or a NICU group or, birth trauma or psychosis, postpartum psychosis, which was my condition. And so, that can be a really safe space. And then we definitely encourage you, to reach out to us as well, as Jess mentioned, to help bridge that healing into systems change. Um, and I'll just dovetail into Dejan's awesome question. Where could someone begin if they had identified or experienced a gap, and how a statewide policy is applied to get a ball rolling, to highlight it and change it? I think that is such a great question, and that is the process that we're hoping to help folks along on this journey here. And it starts with talking, sharing your story, talking with the folks in your network, whether that's friends, family, colleagues, other providers. It can also be talking with your legislator. So someone like Monea, who works for Senator Smallwood Cuevas, you can request a meeting of anyone in your government, right? So it could be local, regional, state, national, and set up a meeting and talk about it. And that's where, CPWA is here to support you in those legislative meetings. We can help you, make an agenda, practice your story, and really that's sort of the next phase of what we're hoping will come after SB 626, is really identifying across our community here in California what are the policies that aren't working and need more support around implementation. And then lastly, I see Christy's question, where to go next, how to jump from healing to leadership, from leadership to advocacy, and even what's available to become more involved. I definitely encourage others to come off mute and share. But I think just showing up today and being a part of this conversation is a part of that. And it might be listing out your story and using that five piece framework that Jess shared to really nail down, what were the gaps, what were the barriers, and where's the opportunity for change based on what's happening now, right? And so that could be something that we'd be happy to talk with you more about. But that is the work of advocates coming together to align on what are the systemic gaps and barriers and what do we need to do to change. And that's part of the work we're doing through our statewide storybook of we now have, 60 stories from across California that show, what are those challenges. And so the more we can uplift our stories and we can see the Me Too's, right? And see the systemic connections.
Yeah, and I just want to add on to that, from my perspective, the best way, just to answer the last couple questions, is really to do research, do a lot of research on what gap you find that should be changed, what policy should be changed, and really identify your elected officials and set a meeting with their staff. You can either tell them what you want to see differently. You can just talk to them just to get your story out there, and you don't even have to ask for anything, or you can just share the data and the research that you find. I meet with a lot of people that don't even want me to do anything. They just want someone to listen and to read their research and read their data and just to get the conversation started. Um, just to put that out there as well.
Awesome. Thank you, Monia. Jess, should we move on to the next?
Yeah, I think that sounds good. Moving on to the take action piece. So go ahead, Cassie.
Thank you so much, Jess, and thank you everyone for coming off mute and coming in the chat to share these great questions and great discussion. So I do hope that today's conversation has shown that your story has value, not only for your own healing, but for helping other families. And movements grow one story, one relationship, one action at a time. So there are a lot of ways that you can get involved, and we invite folks to choose whatever feels right for you. You might share or update your story by September 1st in time for us to deliver it to the governor in our statewide storybook to help pass SB 626 across the finish line and make a difference for countless families in California. And we accept stories both from survivors and providers and family members. So if you identify anywhere across, those identities, you can even submit multiple stories, and that is really helpful, again, to build the case for all the changes that are needed in California's perinatal mental health system. You can also send an individual or organizational support letter for SB 626. We have examples on our website. Maybe Kirsty can put that in the chat. And that can be a great way to start, building that relationship with your elected officials. You can contact your assembly member at the state level or your senator, or even, your local representatives. And that can be a great way, as Monea said so beautifully, to build that relationship, to, bring in your research or your story, and start that conversation and even hear what are your elected officials doing on this issue and issues you care about. You can also invite another storyteller or organization to be a part of our movement. And you can join CPWA's Advocacy Network. We have a monthly newsletter that has opportunities to take action, both for SB 626 and beyond. So, we're really hoping to have these ongoing virtual convenings where we can come together as an advocacy community, continue exploring ideas and opportunities for change. Our next one on October 8th, something that we're thinking about is uplifting a new regional model for building California's perinatal mental health movement, where different regions across California can come together and identify what's happening in your local communities, and help to inform statewide efforts. And then we'll also have a number of other updates to share about SB 626. And, we have our California State Roundtable that we're leading to continue pushing for systems change with the administration. So we definitely hope you'll join us on October 8th and continue to learn new resources and ways to take action. And please remember that you don't have to do everything, right? You only have to choose one next step. And it's through those small actions, one step at a time, that we create collective action. And it's the collective action that creates that systems change. And that's how we build a California where every family receives the care that they need and deserve. So with that, I'd love to transition over to Somo to close us out.
Thank you, Cassie, and thank you to all of you here. Grateful to our presenters and especially Jess for all the work that you have done to help people feel comfortable sharing their stories and bring it all together in a storybook, which we hope will land on the governor's desk shortly. Also appreciate the various storytellers who have been a part of CPWA's network and shared their very personal experiences and helped drive change that way. We're also thankful to several CPWA coalition partners who are on our call today, organizations like Maternal Mental Health Now, who Cassie mentioned, who provide these venues for and safe spaces for you to start practicing your story and processing with others. And certainly thank you to all of you for your vulnerability today in sharing your anger, your upsets, and the various things you are still processing and the questions that you have. These are all really great questions, and we hope that you feel comfortable reaching out should you have further questions or want additional support. We hope this is a useful starting point in your storytelling journey. As a survivor myself, I've also found it helpful that the more you tell it, the easier it gets as you're able to point to the things that really matter to you and the systems gaps that you see, and that they really make a big difference. We hope you will stay connected in the ways that Cassie just mentioned, because we don't want our collaboration to stay here. This is really a movement, and we can't grow it without you. Uh, as so many speakers have said today, stories help anchor us in the why. They can be healing, help us feel less alone, build community, validate our experiences, allow us to process. And stories can also drive action. It doesn't end in just the healing, although that is important as well. One piece that may be helpful is that research actually shows that stories are 22 times more effective than just facts and figures alone. So it's great if you can do the research, bring those facts and figures and your findings, but remember that it's your personal experience that people really find memorable. It helps make the data meaningful. It can change perspectives as well as public opinion and really persuade decision makers. So together, what we hope is that these stories move us towards real systems change, and ultimately so that families can tell new and different stories about perinatal mental health. Thank you so much for joining us today and for being a part of CPWA's movement. We look forward to staying in touch.